for this one that we're going to go over, it's going to be implementation is what we're going to be looking at. And it's for preschool age to school age children. I'm going to just read through the scenario, and you guys can read through it as well. It's just like a few paragraphs. It's pretty brief. And then afterwards, we're going to go over these questions, and it's just going to be an open discussion. You know, there's not necessarily right or wrong answers to some of these things. It's just, you know, people may do them differently. So. All right, so for this one, it's called Important for Me or Important for You. This is definitely something that I've encountered as a BCBA, so I think this is a good one to kind of determine where should we be focusing on what things are important and how we're going to address them. So I'm just going to go through and start reading this. Tracy has been an early childhood educator for more than 30 years and is well known and respected as an educator in her community. Year after year, she leads teams of educators at the local early learning and childhood center Great Beginnings, rotating between preschool age and school age classrooms. In her preschool class this year, Sarah, an energetic 3-year-old, Sarah joined the class only a few weeks ago after her family moved into the community. During an initial interview with Sarah's parents, Tracy learned that Sarah had a language delay, which causes her to have difficulty expressing herself. Her parents explained to Tracy that because of this, Sarah is often frustrated, and this frustration often escalates into crying, temper tantrums, throwing objects, and at times even hitting others. Tracy has a warm, gentle, but firm approach to managing the behavior of children in her class. It did not take long before she began to see Sarah's frustration. Last week, Sarah wanted to join 2 other children, Aiden and Noah, who were busy playing pretend dress-up. Tracy watched as Sarah approached the 2 children and appeared to try to join their play. Having difficulty expressing herself, she had trouble keeping up with their fast-paced dialogue and conversation. After a few minutes, Aiden and Noah began to ignore Sarah, causing Sarah to become very upset. It did not take long before this escalated to Sarah crying and ripping a piece of the dress-up clothing Aiden and Noah were playing with. So Tracy has been responding to Sarah's behavioral outbursts, as she always has for all the children in her class each year, with stern verbal reprimand followed by a brief timeout, often in the corner of the room, facing the wall. Tracy believes that Sarah has to learn that her outbursts are not acceptable in the classroom. After about a week of this recurring pattern of Sarah's frustration and behavioral outbursts, Tracy reprimanded and gave Sarah a timeout. Tracy also decided that a referral to a local early intervention program was needed. With only herself and 1 assistant and a class of 15 preschoolers, Tracy was struggling to both respond to Sarah and support the other children in the class. During her initial phone conversation with Rachel, a board-certified behavior analyst, Tracy noted that she would like behavior consultation because Sarah's behaviors has to change, and further thought that Sarah would benefit from one-to-one intensive behavior intervention, which they'll list as IBI, to teach her social skills. I can't have these types of outbursts in my classroom, Tracy told Rachel. Rachel listened carefully and supportively to Tracy, and after more than 20 minutes asked whether she can come into the class to see what was happening. So Rachel, the behavior analyst, was looking forward to meeting Tracy and supporting her develop a supportive intervention for the difficulties that Sarah has been experiencing. She was particularly interested in guiding Tracy to think about both the topography and the function of Sarah's problematic behaviors, and to develop habilitation-based goals and objectives. So when she arrived at the center, Rachel was greeted by Tracy. After a warm welcome, Tracy said, "I'm very busy. Sarah is over there. Please go spend your time with her. Let me know what program you have for Sarah and how long it might be until she can change her behavior." Because I can't have those outbursts in my classroom, of course. So Rachel was stunned. As she sat in the corner and began to observe Sarah in the classroom, she had a reoccurring thought: who was it that really had a change here, Sarah or Tracy? In the meantime, Rachel began to collect data on frequency of behavior, including when it happened, the duration, and the intensity. She collected ABC data for the first morning and asked Tracy whether she could come back each morning during the week. During her observations, Rachel had also noted Sarah's use of verbal operants such as man's, tax, echoics, and interverbals, along with textual and transcription operants. Later in the next week in her office, Rachel analyzed her data and started to complete a functional assessment. After looking at the data, a pattern appeared. In the antecedent column, Tracy had placed a demand on Sarah, such as asking her to put away a toy. Afterwards, Sarah engaged in the behavior that Tracy described as an outburst. Following this, Tracy usually ignored her and moved on to what she had to do with the rest of the children, and usually did the task herself as she was busy and needed to move on. Rachel looked and thought, I think I know what's happening. So, what do you guys think of this just overall? Have you experienced similar things in your settings?
Somewhat.
Okay.
But our reaction was totally different.
Yeah. It's different in ABA clinics versus in schools, but, you know, definitely in pretty much any setting you can kind of get some of this, and especially as you do home health or move into like a consultant role, you'll definitely see a lot of this happen sometimes. So let's look at the first question. So describe how Rachel would have collected frequency, duration, and intensity data in the classroom. Which information did each dimension give her for her analysis? So let's look at frequency data. What are some things she might take frequency data on?
The number of times she throws. The number of times she throws.
Yeah, definitely the number of times that she throws something. Let's look at what her behaviors are. Let's see. Okay, so the frustration. Crying, temper tantrums, throwing objects, and even hitting others. So those are some of the behaviors that we're looking at.
What about the number of times the demand is placed on her?
Yeah, that's definitely something you can take frequency data for as well. And it didn't mention it here, but you could also take percentage. I would be taking percentage data on that, the number of times that a demand was placed, and either plus or minus if she followed the demand or not. So what about duration?
How long the temper tantrum happened.
That's right.
I would be interested in the time between the demand is placed on her and the time that it's actually completed. So whether putting away the toy or the toy, or even Sarah's putting away the toy herself.
Yeah, I definitely agree with that. And that's something that I would want to look at too, is that latency of when a demand was placed, of does it ever get completed, or does the teacher complete it herself? How long does she wait before she prompts her? Kind of all of those things, because that's definitely going to, you know, be something that you're going to want to write up as a goal to work on, and this will give us the baseline information for that.
For the teacher as well.
Yeah. I definitely agree with that.
You can't place a demand on a student and then just let it go. Your word is nullified at that point.
Yeah. And then what about intensity?
I guess am I coming through clearly?
Yeah, you are.
Okay, great. I guess the intensity of the outburst, so to speak. So the level, the voice level, the intensity. If she's hitting someone, is it a light touch? Is it something that caused injury? Things like that.
So how would you take that data?
How would I take the data? Well, I guess you could predetermine levels. So if you wanted to track loud, what we would call loud screaming, like screaming that would be to the point that the teacher could not address the other children because it was so loud, or a lower level that could basically be ignored, and
Yeah. And that's why I asked that too, is because there's not like an official way to track intensity. You can come up with different types of measurements beforehand, or you could even write a descriptive narrative of what's happening and then apply, like create categories after the fact to code each instance into. So yeah, either of those is good. So then, what information did each dimension give her for analysis? We kind of talked about each of those, but like, what is all this information going to tell her? She's just sitting in the corner, basically taking a lot of data and notes. Why is this helpful?
Well, to potentially identify function.
Either of you.
Oh, I was saying that she's collecting baseline data. That way, when she starts implementing the intervention later on, I mean, she can compare the baseline to the treatment data.
Yes.
See if there's actually an increase, or non-increase, but decrease. Sorry.
Exactly. You need to know where you're starting with all of this stuff, because once you start creating an intervention, you know, then we're gonna be seeing changes. So yeah, it's really good to just do this during the assessment, get this baseline data, and also, you know, insurance-wise, a lot of insurance companies want to see the baseline data on the initial report so they can see if you're making changes or not as well. So describe Sarah's outbursts in terms of function-based and topography-based descriptions. So let's talk about topography-based first.
Okay.
So what does her outburst? What's the topography of her outbursts?
Just what it looks like, what it sounds like. I can objectively describe it as crying, throwing items, what items she's throwing. Basically, just be what does the behavior look like?
Exactly. So then, what about the function-based, and how are we determining the function of the behavior?
So the function-based it basically tells us why the behavior is occurring, or what exactly Sarah intends to get by engaging in the behaviors, and basically we can get some information as to what happens immediately after the behaviors. If after getting some attention she goes quiet, then the behaviors may be done in an attempt to get attention.
Exactly.
Or if we give her access to something, then she immediately stops the outburst, then the behavior could be meant to serve those functions, getting access to those items.
Yep, that is correct. So I know this is a upcoming question. What is the function of Sarah's behaviors, just based on what we know so far?
I would escape, untangible, possibly attention seeking.
Okay, so let's look at this situation right here. So Tracy placed a demand on Sarah, such as asking for her to put away a toy. Afterwards, Sarah engaged in the behavior that Tracy described as an outburst. Following this, Tracy usually ignored her and moved on to what she had to do with the rest of the children, and usually did the task herself as she was busy and needed to move on. So I would definitely say that this is not attention, because she doesn't look to be getting attention. We know that Tracy is using a lot of timeout behaviors. So so the functions of behaviors here: sensory. No, it's not sensory. It's not likely attention because she's not getting social interaction from it. So what do you guys feel about escape and tangibles?
Escape looks pretty clear to me.
Yeah.
Escape, but does she really understand what is being placed, the demand that's being placed on her?
Yeah, she could also not understand what the demand is, but that would still, I would still say it's escape, because she was asked to do something and then she engaged in an outburst, and then she got put in timeout or ignored.
Right, the consequences driving the behavior. And there weren't any notes about her having receptive difficulties expressive, so I wouldn't be inclined to think that she was not understanding necessarily.
Yeah.
Well, that's entirely possible. So,
And I mean, it can even be escape. Let's say that she was asked to do something that was too hard for her, that she didn't understand. She's still engaging in the behavior to get away from the demand.
Yeah.
All right, let's look at the next one, because I would say that that one is escape. What other components or information would Rachel need to complete to ensure that her functional assessment is accurate? So she has this information, the data on the behaviors. She's talked to the teacher a little bit. What else would she need?
My first. Go ahead.
Okay, I think she would need to rule out any other alternative explanation as to why the behaviors are occurring. For instance, maybe some other setting events that could be distal from the behaviors. For instance, does she get enough sleep at home?
Mm-hmm.
And probably some other things that usually happen prior to behavior.
So those are some of the things that you want to look at for sure. I would say that those relate more towards sensory or automatic behaviors sometimes, because this, like, we can see a clear relationship with the ABC data. Demand, tantrum, ignored. Demand, tantrum, ignore. So if that's a very clear pattern, then it's unlikely that it's necessarily outside events. But I mean, it's good to look at, like, let's say I have a kid that's banging their head on the wall. I'm going to have the parent take them to the doctor first to make sure they're not having headaches or sinus infection or something like that.
But earlier it stated that she did have some language delays.
Mm-hmm. Yeah. So she has some language delays, so she can't effectively communicate. We know that. So that would definitely be something we want to look at as a replacement behavior. But I wouldn't say that, I mean, she's still using these behaviors to escape a demand, or, you know, like with the issue with the other students, you know, that kind of comes into play a lot there as well.
Yeah.
Any other information that you think she would need for the functional assessment?
I would just be curious to see if there's a difference in response between the two adults in the room. Not that would change the function at all, but I would like to have some information around that.
Yes. I would like to see that as well. Another big thing that would need to be done, because it doesn't, I mean, it appears that this BCBA is coming in as a consultant, doesn't work for the school. Talk to the parents. Definitely a big thing there, and see what this looks like in the home setting as well, and what they do in the home, because, that's definitely, we're only getting part of the picture by just looking at this one setting. And along with that, I mean, I know she didn't get to talk to the teacher very much, so just like setting aside a time to have a teacher interview, parent interview, to just get more details about these things, aside from she's over there, go hang out with the kid.
Yeah.
Another thing, which we're going to skip this one, is the FAST, which you can include in functional assessments, is some sort of standardized behavioral questionnaire. The problem is that studies show that these are not accurate, because a lot of times you're asking them to be filled out by parents or teachers, and they do not reliably tell you the functions of the behavior. If you really want to know the functions of the behavior, you need to do, a brief FA or something like that to see what you can do to actually turn on and off the behaviors. So insurance companies like to see these. I use them. Sometimes I don't base my whole treatment based off of what they say. But this is one of them, is the FAST, which actually, yeah, I've actually not used the FAST. I've used the MAS and the QABF. Of all of them, the QABF does have the most reliability to it. But we can open this and see what it looks like, maybe.
Yeah, we use QABF primarily.
Yeah, that is the, if you have to do one, I would do the QABF. So basically this is just, you know, a whole bunch of questions. Like all of this stuff is really good, but these are things that I include in my parent or teacher interview as well, of like when does the behavior occur. So all of that, the interview part, definitely you need to know that. Even these things, like they're good to know the answers to them, but it's like, don't definitely say that this is the reason why these behaviors are occurring. Don't just go with that and say that it's definitely that function.
Are you guys getting an echo as well?
Yes, I am.
Now I'm starting to.
Did anybody change something with their microphone settings?
No.
Okay. All right. So we've already went over this. What is the function of Sarah's behavior? Most definitely in this situation, it's escape. I would say in this situation here where she tried to play with them, that in this one, it could be like attention or tangible because she tried to play with them and got upset when they started ignoring her. But for this one, it would be escape. So we've kind of already looked over that. And this is a really good acronym just to remember the functions of behavior, is SEAT. Okay, determine 2 intervention goals based on the information from the ABC data and the FAST. So don't really worry about the FAST, and they don't have to just be behavioral. Like, just what are 2 goals that you would work on for her? So what does everybody think? Go ahead and unmute yourself now. Lots of things we can work on here.
Really hate play goals, but I think it's kind of her age. For all students.
Okay, so question, why do you hate play goals?
Hate implementing them.
Okay, so you just don't like doing them.
So I haven't had to deal with them. This is my first year really with them.
So for her, I think that the play goals, you know, that would be more social based. It seems like she didn't really have deficits playing with items, so I wouldn't necessarily have an independent play goal or anything like that, but definitely a social aspect to that. But one thing that, you know, we definitely need to work on is her verbal stuff. So her language, you know, getting her, she has a language delay. So it doesn't say that she's nonverbal because she does use mans and tacks and interverbals, and then just working on that a lot more, getting a lot more verbal responses from her, getting her to request things from other kids, like even such basic things as like, can I play? Can I have that? You know, getting more social communication from her on that way. And then also work on compliance as well, getting her to follow instructions and specifically reinforce her following those instructions, I think is a big part of it as well, that isn't being addressed in the classroom. I mean, think of a classroom setting that the teachers give you instructions, but how often do you get specifically reinforced for all the instructions that you're having to follow? So I would work on that with her as well. So functional communication and increased compliance would probably be my 2 main intervention goals. So what intervention strategy would you implement with Sarah based on the functions of her behavior? What does Tracy need to change as well? And then also think about a functionally equivalent replacement behavior that meets the same function. And so based on that, what would we teach her for that?
I'm sorry, I missed that last part. My computer went to sleep.
Oh, okay. So just intervention strategies based on the function of the behavior. What would we tell Tracy to do? And then what replacement behaviors would we try and teach her?
Okay, and Tracy was the teacher or
Tracy's the teacher.
Okay, yeah, I would get Tracy to rely much more on positive reinforcement of appropriate behavior and drop the stern reprimands and the timeout to the greatest extent that she can. and set up figure out, obviously determine what's reinforcing for the child, and go from there. Start off with a fairly thick level of reinforcement for following instructions, following commands.
So what's a replacement behavior we would give her for her escape maintain behavior?
Well, she could potentially request or ask for if she's wanting that, she could teach her to request that, requesting it, but still she would need to follow through with whatever request for that was.
I would also think about teaching her to request for help as well.
Right. Yeah, right. If she's not understanding how to able to do what she's being able to do.
Because it could be that, and if it's just that she doesn't want to follow the instructions, think about our last group meeting that we had as well. How can we pair the environment to make her not want to just escape from any demands that are placed? And I would incorporate some of those things as well, even though it's not like a DTT setting, still pairing the teacher, pairing the environment, pairing the instructions with reinforcement.
Can she also try to do something maybe to improve the attention span or the period of time over which Sarah is engaged on a task?
Did it mention that was a problem?
Well,
that is something that I do with kids sometimes, but I'm trying to see if that was an actual issue for her. I don't think that was a big problem, was her attention span. Also, since she's 3, I wouldn't really be working on a huge attention span for her. Now, if it said something that, like, when the other kids come to the table, she can only sit for 30 seconds before she gets up and tries to run around the classroom, anything like that, I would definitely work on the attention span. And I did say she's an energetic 3-year-old, but I don't think that's a big issue for her. So I wouldn't work on that with this client. At least not at this time, unless I saw that was a problem. Yeah, I'm not seeing that in there. But that is a good goal to do with a lot of my kids I use that with, so. So looking at the assessment, what other assessment would you include? I would say, well, she didn't talk about the assessment that she used except just looking at behavioral stuff. So those of you that are familiar with the different assessments, what assessment would you use with this client? Yeah, like would you do the VB map or the AFLs or the ABLs or a different assessment?
I would probably start with the VB map.
I also agree. I would do the VB map specifically. Yeah, because they mentioned that she has language delay, and that she has some of those things. But even though we're called in to work on, stop the behavior, well, the behavior seems very much that it's due to her inability to communicate effectively. So the VB map would give us a good picture of some deficits that she's having, and it's age appropriate for her. Okay. The results of the assessment are not present, so I don't know what that question's talking about. So, basically we've already talked about intervention goals, so we'll skip that one. So how would you, the last question, how would you respond to Tracy's request for a behavioral program for Sarah? Could the behavioral supports offered by Rachel include both one-to-one IBI program and broader behavior consultation? So, how would you go forward with this?
I would try and provide consult as well as direct services so that Sarah is building a trust with with Tracy
Mm-hmm.
and follows instructions in the classroom as well as just a knee-to-knee setting.
Yes.
Does that make sense?
It does. And I agree. I would do both of those things. You know, definitely she needs consultation stuff and, you know, more education on you can't treat all kids the same because they're not all going to have the same functions and reinforcers. And then also work on those skills with Rachel. Any other thoughts or ideas?
It might be worth trying to model some of these things for the teacher, in case it's something that she just is very unfamiliar with and she's not comfortable as far as providing reinforcement for appropriate behavior. There may be a need to adjust the way that demands are given, or really looking at what are priorities. Sometimes I see heavy demands being placed on children when the teacher finds it to be something that's really important, but it's really not that critical. So I would look at that as well. I mean, if we're going to focus on something minor and lead to an outburst or a tantrum, and then that would prevent us from getting to something more essential with the educational program. Does that make sense?
It does, and I do agree with that. You know, working on things that are within her skill level, and things that we're working on, and also things that matter. You know, like again, we don't need to work on things that are not a big deal in really any other setting and shouldn't be a big deal in a classroom. So, yes, I agree with that. Any other thoughts in general related to this case study? Or questions? Okay. If not, I'm going to move on to some exam questions that we can go over as well. Let's see. Okay. And these are on, oh, I forgot where, I think it's like Prof Pros or something like that. They have a free mock exam on there. And I just pulled some questions from different parts in it. Tried to pull some of the ones that I know you guys have gone over some of this information in your assignments. So if you have any questions about these, you know, definitely everybody answer to them. And if you have questions, you know, we can talk about that a little bit more. I have 9 or 10 questions on here, so we have time to go over some of the information if you don't understand it. So a behavior that is elicited or induced by an antecedent stimulus is called a
Respondent behavior.
Okay, and how do you know that?
Operant behavior is driven by consequences, and respondent behavior or respondent conditioning is driven by antecedents.
Good.
Typically.
Yes. And an easy way that I remembered this is that the only behavior that is elicited is respondent behavior. So anytime you see it's elicited, it's always respondent behavior. Operant behavior is not elicited. So respondent behavior. Does anyone else have questions on that? Did anyone else have any other answers? All right. Answering the door when you hear the doorbell and not when it is silent is an example of behavior being under
Stimulus control.
Okay. Stimulus control. Does anyone else have any other answers or thoughts on that?
I would think stimulus control as well.
Okay. Good. The answer is stimulus control. Okay, so behaviors have blank if they affect a person's life in a positive and meaningful manner.
Functional application.
Okay. Any other thoughts?
I would say social validity.
Okay. So we have social validity and functional application. What does everyone else think?
think that A both make sense, but on a test, it would be A.
Okay. And I'm not looking at you guys, so I'm not sure which one of you said functional application, but why do you think it's functional application?
Functional application means that we can apply it. And I'm thinking a positive. Functional. I'm thinking of the dimension.
Okay. So which dimension for functional application where are you thinking of for that?
Well, for functional application, I actually think to if we do something in order to test the functions of whatever the behavior finding is. So functional application with the function.
So it can have, yeah, I mean, it can have to do with the functions of behavior as well, but functional application, I'm thinking of, I mean, it can be things that are functionally relevant in the client's life, but I do agree with Chad that this one is going to be social validity, because that is the definition of social validity, that it's, you know, that it affects a person's life in a positive and meaningful manner. I can teach you to do something functionally, like I can teach you to drive a car, or I can teach you to, you know, do these different things, and I can teach you how to do things functionally, but it may not be meaningful for that client. It may not affect that person in a positive and meaningful manner. So I would say the more correct answer is social validity, but I can see how functional application, that you would think of that as well, but functional application does not necessarily mean it's going to be meaningful for that client. Okay, by selecting candy as a reinforcer and deciding that the child can have 3 pieces for every correct response, the teacher has utilized which parameter of reinforcement? How about somebody that's not answered yet?
Is it quantity?
It is quantity.
Okay.
Yes.
With the specific number of correct responses, I mean, they get something in return.
Mm-hmm. Yeah, and what she's thinking of is 3 pieces for every correct response. So let's talk about the other ones. What would be timing?
Getting a reinforcer after like every minute or 2 minutes?
Yes, and it could also be ratio based. So I mean, she talks a little bit about timing because it says after every correct response, but it's more talking about quantity. But yeah, timing would be related to when do you get the reinforcer. And also the immediacy of it would be talking about timing. What about variety?
Getting a reinforcer for whatever response, no. Just at any time? That's what I'm thinking.
I would be thinking of different types of reinforcer. So if you keep using this one candy and giving 3 pieces after every correct response, it's very likely that the client's going to get satiated on that candy. And just if it's all food stuff, she'll eventually get full and it's not going to matter to her anymore. So variety would be like different types of reinforcement. And nutrition is not really a parameter of reinforcement, but obviously if candy was the only thing we had and the only thing we were giving her, that would not be good over the long term if we just kept giving her 3 pieces of candy for every correct response. Okay. Charlie spits on his teacher when he prompts him to complete a toothbrushing task. For obvious reason, this behavior really grosses out the teacher, who refuses to work with him when he behaves like this. So the teacher is obviously not a behavior therapist. When Charlie spits on him, the teacher walks away and allows Charlie to leave the toothbrushing task and go to the computer to calm down. As long as he's playing on the computer, he rarely spits on his teacher. What is the most likely function of Charlie's behavior?
Escape.
Okay. Any other thoughts?
I would say
Escape and tangible.
Okay.
Actually, I didn't see that one. Tangible because he's getting the computer, and escape because he's escaping from the toothbrushing task.
Mm-hmm.
Sounds like Charlie's getting trouble to deal with me.
Yeah, right? He's going to start spinning on everyone. Yeah, so I also say escape and or tangible. Because one, he is escaping, and two, he's also getting a computer. How would we test this to determine if it's one versus the other?
We could unplug the computer.
Yeah, you can unplug the computer.
Remove that as an option and see.
Yeah, remove that. Yeah.
And try maybe some other. Well, I mean, you can run an FA, I guess, to see if he does it when he has access to everything he wants. Obviously, he's not doing it against the computer. But yeah.
Yeah, I agree. So, I mean, of course, we can do an FA, but yeah, I was kind of thinking more like in the moment, like what you said, you could just unplug the computer and make that not not something that he accesses, and see if the behavior goes down if he just gets escape and not escape plus attention, or escape plus tangible. But honestly, it's likely both of those things. David gets prompted with a touch on the shoulder, then a light touch on the back, and then just a hand in front pointing to where to go. What is this an example of?
C or D.
Okay, so far we have B, C, and D are options. Does anyone think it's graduated guidance?
Honestly, don't recall the definition of graduated guidance at the moment, so I would lean towards B.
Okay, B. Lynette, what about the least to most prompting and the physical prompting?
Because the least to most of it is touching the shoulder to give him the prompt.
Is that least to most, though?
He's given least prompting, which is the touch on the shoulder, and the most prompting, like by touching the back of the hand.
So I would say no, that it's not. So touch on the shoulder, then light touch on the, so let's say this is, it looks like they're trying to direct him where to go. So first there's a touch on the shoulder at a normal level, and then a light touch on the back, and then just a gesture prompt. So really that's most to least prompting.
Most of, yeah.
Okay. And what about physical prompting?
Physical would be like hand over hand. There wouldn't be like anything.
Yeah. Just hand over hand. Or actually.
Yeah.
Actually,
and I mean,
shoulder up.
Touching on the shoulder and touching on the back can be physical prompting too, because you are touching them. But the gesture one is not physical prompting, so I'd say it's not that one. And the graduated guidance, that's mostly used for like task chaining type tasks, so it's not graduated guidance. So I would say that this is most to least prompting. Can somebody tell me the list of prompts from like most to least? What's most intrusive to least intrusive?
Physical, hand over hand.
Okay. And then what?
Partial.
So full physical, partial physical. What would come after that?
Gestural, but I could be wrong.
Okay, so I heard verbal and I heard gesture. Which one is most intrusive, verbal or gesture?
Verbal.
That's correct. So full physical, partial physical, verbal, then what?
Partial verbal.
Partial verbal, yeah.
And then gesture.
Gesture, and I'm also hearing proximal. Tell me what you mean by proximal.
Like when you have 3 cards, sliding the correct card a little bit closer, so it's in a closer proximity to the student.
So that would kind of be in a different category because that's a stimulus prompt and these other ones are response prompts. But yes, those, I mean, that's definitely in there as well, and I would say that that would come after verbal prompts, yeah. It's just a different type of prompting. So I would say after verbal would be gesture, and then independent. So, and then there's also model prompts that you can do a model as well, which would be, that would be before gesture prompt. Good. Okay, I just want to make sure everyone was good on those. All right, look at the following graph from functional analysis of Elsa's tantrums. What would you conclude is the functions of Elsa's tantrums? So just to make sure everyone sees it, this one here, that is contingent escape. This other one up here, that is contingent attention. This one with the diamond shape is alone, and the one with the X is control. So escape, attention, alone, control.
Definitely attention.
Looks like attention.
Okay, definitely attention.
Definitely attention.
Okay, so I guess the question is it attention or is it attention and escape? Or do we not have enough details to determine it?
I wouldn't have enough data.
Okay. Why?
I don't want to see where is pending.
Sorry, say that one more time. The echo I couldn't hear.
I think if we're using an alternating treatment design like this one, we can actually look at the last sessions, or maybe the last 3 sessions, to see if there is a clear distinction between the functions.
Okay.
So in this particular case, there is a clear distinction between the attention function and the escape. The attention seems to be continuing to escalate, whereas the escape appears to be on a downward trend. So in this particular case, I would say attention. Attention,
okay. I would say it's definitely not D. So that the behavior is undifferentiated and therefore that the analysis is inconclusive. I mean, it's clearly differentiated for these, and it is very typical to have a multiply controlled behavior because behaviors aren't as, black and white as that. You can see multiple control. So I wouldn't say that it's undifferentiated or inconclusive. Anyone else have any thoughts on attention versus escape? Okay, so for this one, I said it's both escape and attention. So yes, there is some differentiation here, but it only goes down in this one point. There is never any instance where it is at 0 or it's ever lower than 70. And this is the percentage of intervals where a tantrum is occurring. With them being both so high, I would say that it is multiply controlled by escape and attention, which, I mean, just think of what a child gets a lot in their typical life. You have a 5-year-old, you ask them to do something, and they go into a tantrum, screaming, throwing things, flopping on the floor. you don't just let them get out of doing the thing. Parents are also going to go over there and give them attention. So tantrums are, I would say, often multiply controlled by those types of things, specifically in that setting, because I don't know naturally any parents that would just let them escape without the attention aspect. So that's how those things become multiply controlled. Now, if I saw escape or attention, whichever one, if I saw one of them up here and then one of them in like the 40s to 50s, I would say that the primary function is attention and the secondary function may be escape, because there is a difference between them. One's a little bit lower, but with both of them being in these 70 to 100% range, and even, you know, having a lot of overlap here, that it is multiply controlled by both. Do you guys have any questions about that?
What if there was like variability in the data? Like it just goes up and down, up and down, up and down.
Oh.
Like, can you tell if like it's the one over the other?
I mean, I would have to see it to determine, but basically what you should see is that with a functional assessment, at least the way that I do them, I do a brief one, which is 10 minutes, and you are scoring like each 1 minute interval, how many times the behavior occurs, and as soon as it occurs in the escape condition, you let them escape from the demand. As soon as it occurs in the attention condition, you give them attention. So, I mean, if I saw a lot of just like up and down, you know, I would wonder if, you know, if the, like, let's say the attention condition, sometimes it's at 80, sometimes it's at 20, 50, 0. I would want to look at what it looked like in other conditions, if it's maybe an automatic behavior that is happening, you know, in escape, but is it also happening just as variable in other conditions? In that case, it might be more of an automatic thing. But I think it would just depend on the client for me to really be able to answer that question accurately. Any other questions? Nope. Okay. All right. Well, that's our hour. We're at 10:30. You know, I'll see you guys in another 2 weeks for another one of these. Let me know what you think about doing the questions, doing the case study. If you like that, I can incorporate more of those. Or if you prefer just like the talk about certain topics, let me know. If you guys want to hear information on a specific article or a specific topic, feel free to let me know, and I can do it on really anything. And I will post this on your Dropbox as well. There are 2 more questions on here that we didn't get to go over. If you have any questions about those last 2, just email me and let me know. Okay, otherwise that's all I have. If you have any other questions, just let me know.
Cool. Thank you guys.
Thank you.
Thanks.
Bye.
Bye.
Thank you. Bye.